am your host, Jack and welcome to the Medcastplus show. On the show, I'll feature local community physicians who are experts in their respective fields and will share their experience and wisdom so as we as a community can achieve awareness of health-related issues. I invite you to get involved so we can all become educated and tightly connected and to make a difference. Today we'll be focusing on diabetes. Over 30 million Americans have diabetes. It is one of the most costliest and most common conditions in America. It is likely that one of us each knows someone with diabetes. It not only affects our blood sugar levels, but can have effects all over our body. Today, we are very, very happy to welcome Dr. Iraklii Buziashvili, an expert in the treatment of diabetes. He is an endocrinologist and practices locally here in Brooklyn. Welcome to the show, Dr. Buziashvili.
Hi, Jack. Thank you. Thanks for inviting me.
Before we carry on, is it okay that I call you Dr. Buzz?
Yeah, that's perfectly fine.
So, Dr. Buzz, tell me a little bit about yourself and how you became an endocrinologist here in Brooklyn. Where are you from?
So, I was born in Georgia, which is the Republic of Georgia. Many people confuse it with the state of Georgia here in the United States.
You're not from Atlanta, Georgia.
I'm not from Atlanta, Georgia. I was born in Republic of Georgia, and I grew up and probably spent more than 20 years in Russia. That's where I got my medical degree. And when I was 27 years old, I came to this country where I had to pass my boards in medicine. And then I did several years of training in first internal medicine and then endocrinology.
So you're a young, excited doctor. You arrive here in the United States of America. Where did you start your training?
I did my training in Mineola, New York, which is outskirts of New York City. And I did my both residency and fellowship in Winthrop Hospital. And I was very happy doing my training over there. Since then, I moved to New York City.
So you're out in Long Island, you're at Winthrop Hospital, a busy university hospital. You complete your internal medicine training. That took how many years?
The internal medicine was 3 years of training, followed by 2 years of fellowship in endocrinology.
So here you are, you have done college, you completed a PhD, you've gotten your medical degree, so you're now 100 years into your training. You come here to Brooklyn. Why Brooklyn?
Well, for two reasons. First of all, my relatives by that time lived here in Brooklyn. And second, a big Russian-speaking community in Brooklyn needed a Russian-speaking endocrinologist. And I got an offer from one of the hospitals in Brooklyn to work for the hospital.
And you mentioned about the need for an endocrinologist in the area. And we see this quite a bit. There is a high demand, not only here, but across America for endocrinologists. Why is that?
Well, probably because the most common problem that we deal with on a daily basis, which is diabetes, it's still on the rise, and there are a lot of people that don't know they have diabetes, and probably more people are at risk of diabetes, and they also don't know they are there.
So because of the rise of diabetes, so many people across this country have diabetes. There's a need for docs like you, who are endocrinologists, who are experts in treating diabetes, to help get folks under control, to get their blood sugars under control.
Pretty much, yes. The diabetes is probably still one of the most common reasons why people go to doctors, why people are admitted to the hospitals. And as you've mentioned before, it's probably one of the costliest medical problems that we have.
So, as an endocrinologist, explain to me exactly what you do, because I know, as a gastroenterologist myself, a little bit about endocrinology. I know that when I have a patient with a hormonal problem, I send them to someone like you. So tell me, what does an endocrinologist focus on in their practice, aside from diabetes?
Sure. So the endocrinology actually means a part of medicine that deals with hormonal problems. And the word itself, the endocrinology, means, if you translate it from Greek and Latin, it means secrete into, or secrete into the inner part of the body. And by that, we mean that endocrine glands or endocrine organs, they secrete their products or hormones directly into the bloodstream. as opposed to some of the exocrine glands that you probably deal more with, like exocrine part of the pancreas, or salivary glands, or any other glands that have ducts. Endocrine glands, they produce the hormones directly into the bloodstream.
So what you're saying is that endocrine, meaning inside, the hormones you deal with are inside the blood vessels. The hormones get secreted into the bloodstream and they float around the body. And in our field of gastroenterology, where I practice, we deal with exocrine, meaning outside. So there are certainly hormones that can be secreted into our mouth or into our gut where we digest our food. But endocrinologists like you focus on the hormones that are in the bloodstream. What are some of the most common disorders of the hormones that you are treating in your practice?
Probably the most common disease that we deal with is, again, diabetes. I would say about 25 to 30% of the patients come in with thyroid disease, which is the second most common endocrine problem, or group of problems, obviously. But besides diabetes and thyroid disease, we deal with many other hormonal diseases, which comprise probably 10 to 15% of the endocrine problems. And we deal with all different hormonal deficiencies or excesses. And I'll just mention the organs that we deal with. Most commonly, these are parathyroid glands, which deal with the calcium regulation. A very important gland of pituitary, which is located underneath our brain and produces multiple hormones that regulate other endocrine glands, including adrenal glands that are on top of the kidneys, as you know, and also testes in men and ovaries in women are also endocrine glands. So we deal with multiple hormonal diseases, but again, the two most common problems that we deal with are diabetes and whole group of thyroid diseases.
So of all of these diseases which we've discussed, we're here today to talk about diabetes. The folks watching today are very interested in diabetes because it is so common. Explain to us exactly what is diabetes.
Okay, so if you want to explain the diabetes simply, it's basically an elevated blood sugar, a blood sugar that exceeds the normal range. And it's actually not one disease, it's a group of diseases. Thereby, I mean that you can have elevated blood sugar because of different reasons. So diabetes is diseases, not one disease. But yes, they all result in high blood sugar.
So if I think I have diabetes, what are some of the signs that I might have that would raise my concern that I should go see my doctor to get checked for diabetes? What are the signs?
Unfortunately, most patients with diabetes, and now I'm talking about type 2 diabetes, which is much more common than type 1 diabetes, and I'm going to go into the details a little later. Most patients with type 2 diabetes, they don't have any warning signs when they're diagnosed. But if we speak about minority of patients that do have symptoms, I would probably mention an unexplained weight gain or weight loss, as well as increased thirst and increased urination. These are probably the most common symptoms, but again, unfortunately, they don't happen in the majority of the patients when they get diagnosed.
And these symptoms of weight loss or weight gain, going to the bathroom more frequently, drinking more often, they're quite common and they could be representative of other diseases as well. Is that correct?
Yes, definitely. You can, or someone can gain or lose weight because of many other reasons, but it's always good to ask yourself, maybe it's related to the blood sugar, maybe I can't explain this weight loss or this weight gain. And obviously I'm not talking about 1 or 2 pounds plus or minus, I'm talking about 5, 10, 15, or even 30 pounds more or less. So it's always important to be aware of this kind of symptoms.
So folks need to be aware of their bodies, checking their weights frequently, and if they notice any simple changes, going to the bathroom more, drinking more water, the weight is starting to fluctuate without changes in their diet, to see their doctor and consider having a blood sugar test. Now, you mentioned there are a few types of diabetes. What's the main difference between what we know as type 1 or type 2 diabetes? Can you explain that a little bit?
Sure. So type 1 diabetes is caused by an absolute absence or deficiency of insulin. Insulin is the main hormone that's produced by the pancreas and that regulates the glucose levels. So people with type 1 diabetes, their pancreas simply does not produce any insulin. Type 2 diabetes, which is probably much more common, which is about 85 to 90% of all patients with diabetes. People with type 2 diabetes, they do produce insulin, especially in the beginning of the disease, but that insulin, for many reasons, or many different reasons, does not work. And they also end up with elevated blood sugar.
So if I were to put it simply, type 1 diabetics, there is no insulin. And in type 2, there's insulin, sometimes even too much, but it's not able to work. And that would be the main difference between a type 1 and a type 2 diabetics. Are they treated differently?
Yes, that's the main difference. You're absolutely right. And a lot of times, especially in the beginning of the disease, they are treated differently. People with type 1 diabetes, since they do not produce any insulin in their body, they require insulin treatment. People with type 2 diabetes, at least in the beginning of the disease, since their body makes insulin, they may use the medications that make that insulin work better. So they do not require insulin in the beginning of the disease.